Okay, this is a cement. The first one which we used it in the lecture was the powder. This was only calcium hydroxide. It's pure calcium hydroxide mixed with either normal saline or with local anesthetic. Okay, you can mix both together because local anesthetic is also sterile. Okay, so the major difference between the calcium hydroxide pure powder and the cement is that it contains fillers, resin fillers. Okay, so the initial powder which we discussed is that it is the purest form. This is glass ionomer. Just keep it there. The major difference between the pure calcium hydroxide and the cement is that in the pure calcium hydroxide form, it is more antibacterial and it will irritate the pulp more in a way that it will regenerate tertiary dentine. Okay, this form, but the problem with the pure calcium hydroxide is it has very low strength, so it will crumble away. Okay, and it's very hard to use with the beginner hands. Once you mix the powder with the liquid like saline or local anesthetic liquid, and you try to mix it, and instantly after I think 30 to 40 seconds or 1 minute it will be hardens out, and you have to put more water in it, and so it's very technique sensitive, difficult to carry it from here to the oral cavity. It's difficult. So what happened, the manufacturers put some resin fillers into the calcium hydroxide and make it a two-phase system. One is the catalyst and one is the base. So these two are placed 1 point here, 1 point here, and then they mix it together. Okay, but the problem with these is that it is itself an irritant because of the filler contents. Okay, but the advantage is what? It has more strength. You can give a better strength to your liner, and you can use it in a way that you can place amalgam or any metallic restoration on top of it, and it will not crumble away. Okay, then there comes the other problem with this cements is that they are again very you have to use it very fast. If you are not using it very fast, it will set on top of the paper or on the glass slab.
They're the same within a minute?
Within a minute, yes. And even if you apply on the cavity walls and now you try to modify it because some of the cement is applied on some walls and you want to remove it, it will, and you, the way you touch this with the probe or something with the excavator, try to remove, everything will come out. So this is the problem with this. So what happened, then they modified again with another calcium hydroxide. This one, this is the light cure one. Okay, it's very easy and convenient to use. You just open it up, apply a syringe, tip to it, and place it directly on the cavity wall. Once used, very convenient. You want to modify it, it will remain unset until and unless you cure it. Okay, it has a light activating material in it, fillers as well as calcium hydroxide. So again, it is not that good in case of regeneration or remineralization or antibacterial action, but it still is more convenient in using. Okay, so that is why I told you, so whenever it depend upon the clinical case, you have to see and judge, and then you will decide which material in which form you want to use. Okay, so with expertise, with continuous practice and with time, you will be able to make your choices accordingly. Okay, so the first one is, this is the most common one, the chemical cure calcium hydroxide cement. Okay, it comes in two pastes. One is the blue and one is the red. The blue is usually the paste and the red is usually the the red one is the base and the blue is the catalyst. And this is the calcium hydroxide applicator. Okay, it has been made specifically for the calcium hydroxide carrying. You can also use this for glass ionomer as well in small areas, in small cavities. Okay, so you will apply the base first. You can always use a paper, and if you see, the property of this paper is that it has a sheen. You see the sheen? It's non-stick. Okay, if you make it wet a bit, it will not stick to anything. Okay, so this is the biggest advantage. So anything within the paper will not incorporate into the cement to fluctuate its properties. Okay.
No absorption.
Yes, no absorption. So it is coated with an insulator type. Okay. The biggest advantage of these are that you use it once. You just remove it, use, and you're finished. Then you can use fresh one for another. In case of a glass slabs, well, it is not that clean. First, when you apply it, you have to clean it up. If you're not cleaning it, obviously this remaining hard will be difficult to be cleaned. The other, even if you completely clean, some microscopic material will still be there and it may incorporate with another material that you are going to use. But for demonstration purposes and to make your idea very clear so that you remember it for the rest of your life, you'll try to use it on the glass slab. So the catalyst, since it is used in a very limited amount, we will only use very limited. So just a drop or a small bit, okay, will be used.
How much thickness? What?
It's very less. Just you can say a drop if you consider it as a liquid, but it's a semi-solid. So just this amount. Okay. I cannot translate it into a millimeter or a gram.
I'm asking the cavity.
Cavity, it should be less than 1 milli thickness.
This will be enough.
It's a liner. Yes. Yes. Or if you want to use it as a base, then it should be 1 to 2 milli. So there is a very less clinical difference between less than a milli and 1 milli to 2 milli. You cannot differentiate with the naked eye. Okay. And this is the catalyst. The most important thing while dispensing this is that never put the catalyst on top of the base. Okay. Keep it a little away from it. Both should be roughly of equal amount. Okay. How much you dispense it, the base, the catalyst should be of the same amount. And then there are two ways to mix it. Either mix directly, okay, or with the mixing spatula. Okay. There are two different tips. You see this one is a cross one and this one is a straight one. There is a purpose of these. Okay. Usually glass ionomer cements and zinc phosphates are mixed with the pointed one, and this one is used for other cements, like for example this one. Why? I'll show you when we'll be mixing the zinc phosphate and all this. Okay. The best way to mix them is to keep the glass slab at the corner of your tray, table, wherever you are using, and try to keep your hand away from it so that it is free. Okay. So we'll mix them in a circular motion. Okay. The end point will be that the gray and the white should mix and make a uniform color. And at the end you will just take it out and put it on the side. Okay. You will wash it or clear it with the cotton. Now this is your mixed material. You see, it doesn't have a gray and white now. They are completely the same. At this point, you will take it with the plastic instrument, the calcium hydroxide applicator, and you will apply it on the pulpal floor. Okay. Try to avoid the walls, and you will apply it like this way, to and fro motion. Let it sit by itself. You are not supposed to make it sit on by force. If you will be doing it, it will not work. And then come to the axial wall. Just do like this, to and fro motion, slightly and steadily. It will goes directly into the tubules. And once you are absolutely sure that you have applied to all, just take out the. So you see the calcium hydroxide applicator is clear. Everything is there. And I have not pushed it or pulled it. Okay. If you need any modification, now is the time. But usually it is not encouraged in the beginners. Just allow it to flow. You are not supposed to do anything. If you do something heroic, it will crumble away and it will either be applied on the walls and this and that. Okay. So this is how you apply. After this, you will clean this with the help of a powder. Yeah, we should clean this as well. Cleaning is very important before it completely sets. Otherwise, it will be difficult to clean. Just clean the extra, clean your glass slab. Always do clean work. It looks good and it feels good. If everything is dirty around you, obviously it is not very good to see. It's clear?
Yeah.
Any step which is confusing or something? No. We have just used it to make sure that nothing is less. If it is more, no problem.
That's it, Doctor.
This is the calcium hydroxide. How you apply.
There is no on the box.
There is on the axial wall. You see the axial wall? Only. The axial wall and the pulpal floor only. Not on the gingival floor, okay? Now if you wait for a minute or two and now you try to modify this thing. So what is the way of modification? This is the biggest problem with the calcium hydroxides. If you try to modify this now by removing it from the walls, if it is applied, it's hard to remove this. Okay? For example, let's see if it is set. If it is set.
Is this chemically cured or self-cured?
No, this is chemically cured. It is still curing. So we'll wait for it to cure it up. In the meanwhile, I'll show you how to. Now, the other one is the calcium hydroxide syringe, which is light cured. Okay, it's very easy and convenient to use. I'll use it on this one. Okay, in this one. First, you try to remove some of the. Okay. Now you know that there is no space between the. We'll remove this.
We're using this as a base now.
Yes. Both usually is used as a base. The liner, the calcium hydroxide pure powder form is used. So you will put it on top of the cavity, okay, and you will slightly push it, and you will see that the fluid is coming out, and you will just go with it, and that's it. Okay. Now the advantage of this is that if you see that some part is applied on the wall, you can clear it now with the help of any instrument. This cavity is small, so I'm using this. Otherwise, you will use excavator or something. Modify it accordingly. You have a lot of time to use it. Okay. And when you are sure that everything is okay, you can light cure it. Can you bring the light cure? Okay, you will light cure it for 15 to 20 seconds. And
Not 30, Doctor. In the lecture, it's 30, I think.
okay, you can make it 30. And you will check it. So how to check with the explorer? You can check it with the explorer. It is hard. Now you can check. So this is how we use the calcium hydroxide. After using it, just remove the tip. Remove the tip and throw it away. Okay? And close it again so that it can be used for another use. What do you mean? If it covers the pulpal floor, that's enough. But it should not be given thickness, just covering. Okay? The glass animal flowable. Yes. There is a spit and Fisher sealants available. Separate. It's usually glass animal with a lot of chlorides. But you can use flowable composite as well. It is also available in this form. You can apply on the pits and fishers and cure it.
What's the shallow?
What is the
Shallow cavity. It's
shallow
bits of
cavity? Shallow cavity is no. Pits and fissures are not cavities.
No, to make remove the caries.
If you remove the caries, the shallow cavity would be the one that you have used, you have prepared for a class 1. You remember 2 millimeter?
Yes, this shallow.
Shallow.
Deep. So
Deep, it may be more than. There is no range. The shallow is 2 millimeter.
commonly depth.
Depth. We are talking about the depth, that is why we are called deep and
Yes,
shallow.
shallow.
Give this to Dr. Mahin.
Doctor, should we keep it in the